The Consortium on Disparities of Urologic Conditions is a not-for-profit organization whose mission is to develop strategies to improve disparity outcomes in underserved populations with urologic diseases, with the current focus being prostate cancer. Dr. Brian Stone is a urologist affiliated with the Walker Baptist Medical Center there in Jasper. He is a member of ConDUC, and he joins us via Zoom today to discuss this. Thanks for joining us, Dr. Stone. How you doing?
Hey, I'm great. It's my pleasure to be here.
All right. Well, prostate cancer, research has shown that it is more prevalent in African-American men. Are you able to put a reason onto that? Why is that?
Yeah, well, that's been the issue. And one of the bigger issues is the lack of African-Americans' participation in research. So we don't have a lot of data, but we know that the prostate cancer is a different animal in men of color, 2.5 times more prevalent and 2.5 times more lethal in black men. So our goal is to try to improve participation in clinical trials so we can get the data that we need to get some answers.
Yeah, I understand what you're saying there, and I do have to say that prostate cancer is something that I was diagnosed with. So it's not all about men of color, it's everything, but we're specifically talking about African men right now, and this. Right. What is ConDUC? What is it about, and what is it wanting to do?
So I've been a urologist 30 years, and the ConDUC group are all colleagues of mine that I've known for the past 30 years. They're at Johns Hopkins, UCLA, University of Michigan, MD Anderson. We're from all over the country. We are urologists, oncologists, radiation oncologists of color. We've decided that because there's such a lack of data, that it's our job to try and fill that gap. And the reason it's important, there are algorithms that are available to try to give a patient an idea about how his outcomes are going to be, but they don't apply to men of color because they have no data. So it's kind of hard to make predictions about how somebody's going to do after surgery, because patients always ask, or after radiation, but we don't have adequate data to give them good information.
Well, how do you fix that?
Well, number one, you involve people who can overcome the trust deficit, because there's some historical issues in research that makes communities of color kind of reluctant to participate in clinical trials. And you can bridge that gap by involving researchers of color. And then we try to get the SCOPE registry trial is basically just men who've had surgery, radiation. We just want as many black men with prostate cancer who've had all treatments in this database, so we have a large number from which we can do research and try to get some answers.
Yeah, and I assume
that really hasn't been done.
Yeah, and I assume PSA is still the main way of finding out if there's a possibility of being diagnosed with that?
Absolutely. But again, when PSA was created, it was created basically on a large population of white men. So there's kind of questions about, you know, what is the proper PSA for, you know, different age groups, et cetera. So having this large data set will allow us to come to some good conclusions so we can give people the right information.
I like that. Good luck to you with that and everybody involved with ConDUC. Dr. Brian Stone, thanks again for joining us. Really good information right there.
Thank you, sir.
All right, if getting fit was on your resolution list for 2024, but the gym was not, we're on your side with a fitness expert who shows us exactly how we can get fit while you take a seat.